Hi, everyone. Dr. Paul here with the weekly COVID-19 update for September 28th, 2022. I'm going to start by looking at our local data. And just to show you right now, we have 16 hospitalizations, 2 in the ICU. So that's still, in the high range. If we look at the overall trends, you could see that we were going on a downward trend. And then all of a sudden we went up as of yesterday's data. But again, overall, in terms of our cases, we have seen a decrease, which I'll show you in the next couple of slides from the ministry. But if we're looking at other indicators, our positivity is starting to now go down a bit. It's sort of flattened down at around 11%, and we do have a 2-week decrease in that, noting that certain areas have higher positivity, particularly in the Cornwall area. A lot of those coincide with the outbreaks that we have, of which right now we are at 12 at this point, and with again almost 240 cases there, which account for the majority of our cases, and 189 residents cases. As I said, you can see almost like a stable number of cases here. That reflects that we do have COVID in the community, and that it is affecting the most vulnerable. But in a more positive side, most of these individuals who are elderly do not have severe symptoms and do not require hospitalizations, which is again thanks to the vaccinations that we're giving right now, that they've had 4 doses and some of them have had 5, and that I think prevents them. That's important to know, that although the vaccines that we had up until now, excluding the bivalent, have protected disease, severe disease, have prevented severe disease, protected the vulnerable, and some studies have shown that overall worldwide, almost 14.5 million deaths have been avoided by the vaccine. So the vaccines do work, do their job in terms of preventing severe disease, particularly among the most vulnerable. Unfortunately, because of the mutation that happened, last year, the Omicron is less. The vaccine is less able to prevent getting the infection, but once you get the infection, and if you've been vaccinated, your immune system is triggered to be able to prevent severe disease, and that's what we're doing. The Omicron will change it, because I believe that the Omicron, and I'll talk about it a bit later, but the Omicron version, the bivalent one, which will prime the body, will actually cause us to have antibodies for the Omicron version, will be, I think, more successful in even preventing spread of the disease. I'll talk a bit in more detail a bit later. If we're looking at our wastewater numbers here, we don't have a big increase. You can see almost a flat line here in the Cornwall area. Again, in the Hawkesbury area, Castleman, it goes up and down, and we always have that pattern. So it's more a reflection of how because we're collecting it from a lagoon there. So we need to look at the Castleman numbers with a grain of salt, and we're seeing a downward trend here in Morrisburg as well. And so again, those are all indicators that from the community point of view, we still have a level of COVID, and although it doesn't, a lot of people may be getting symptoms, it doesn't really affect our overall hospitalizations are stable. They were up again, down again, but overall it's a stable sort of approach. But we still have a level of infection in our area, and again, that's why it's important to continue with the public health measures that I'll talk a bit about later. In terms of our vaccinations, I'm just going to again show you now that we're now tabulating all the doses, even the 5th doses, the bivalents. And you could see here that we started already with this light blue color here, which is the booster number 3, which is the 5th dose, which is the bivalent dose now that we've started giving in long-term care and retirement homes. And so you could see that we still have some work to do for fourth doses for certain populations, and so again, as you get younger here, more people have 1 or 2 doses only, as compared to 3rd doses. So we do need to increase the booster dose. Your next dose we'd like to see it increase as much as possible. In terms of young children, we're only at less than 5% of the population of children 0 to 4 years of age, or less than 6 months of age, actually, to 5. And now we do have a Pfizer vaccine as well that's available for those children as well. So I do recommend parents to, if you have the questions, please ask your healthcare provider, your pediatrician, and so on, because it does. We have seen COVID, despite the fact that we know that in the majority of children, COVID does not cause severe disease. We know that with the Omicron waves, we do get a increase in hospitalizations, particularly among young children less than 2 years of age, because their lungs are a bit more fragile. And so it would be important to be able to vaccinate them as well and protect them from that. We know that the vaccine that is currently available for that age group is effective in preventing severe disease, and particularly among children who have underlying medical conditions, born prematurely, have cardiac issues, respiratory issues, and so on. So it's very important that we vaccinate all age groups. Right now, we have vaccines available literally from the first year of life all the way to the to elderly. So let's take advantage of that. And before I start talking about sort of some of the precautions, some of the things that we're going to be looking for moving forward, I'm just going to share with you another update from the ministry, which is our weekly scorecard that we get. And so just to show you provincially, again, we're seeing a bit of an increase in cases over the last 7 days. It's a 12% increase, but a decrease in deaths, and that's important. And that's what we're really looking at. We're looking at hospitalizations. Again, hospitalizations, a small increase. They're really stable. They're not shooting upwards. They're not going downwards. They're kind of stable. And again, that's what we want to see. We want to see a decreased hospitalizations. In other words, you can have a lot of cases, but decreased impact on the population and requiring hospitalization. ICU numbers are really steady. I get them daily. They're ranging anywhere between 118 to 130, up and down, up and down, up and down, back and forth. So again, those are stable. Again, we need to keep an eye on those. If we're looking at sort of jurisdictions across the world, you can see that Ontario has a slight increase in cases, but almost flat here. Quebec as well. And you could see other countries now having France, Germany increases, but then other countries like Australia, New Zealand, US on the way down. So again, that's why it's hard to say, well, the pandemic is over worldwide, because there's such a variation, regionally and national and international on the international level. If we're looking at sort of the case hotspot areas, you could see that we're among the lightest here. This is our health unit here. So we do have areas that are quite low in terms of cases per 100,000. So again, we are not as, again, it's regional. You could see other areas are higher. Other areas are lower. So again, it varies region to region, but again, this is our area here. Most of it is really below 40, 50 cases per 100,000. Just to remind you, a couple of weeks ago we were really blue. We were around 100 cases or so, and that again was due to the fact that we had a lot of outbreaks, and in the past, like in April and in January specifically, we had a lot of Omicron cases as well. But now again, you could see that tip here, that's our eastern tip, that's our health unit here. For the most part, we are lower in terms of the number of cases per 100,000 from week to week as measured here. If we look at the actual numbers and looking at sorry, I want to show you another one that showed the actual numbers. Where was? Oh, here it is. Again, you can see here we're at 56. Again, a couple of weeks ago we were more than that. We're close to 90, 100, but that's going down. That's sort of downward trend, and you can see again the variation across the province in terms of the cases per 100,000 for the health units. That's us here. That's Ottawa here. Leeds, Grenville, and this is Kingston here. And so again, we are looking at higher levels than baseline. Like we're not at zero. We're not less. I'd like it to be quite low. But the other thing, this is weekly new cases per 100,000. So again, we want to keep that as low as possible. But again, looking at the consequences of it as well. Like, do we get a lot of hospitalizations? Are we getting a lot of deaths? Which we are not. There's a couple of deaths, unfortunately, that have occurred, but not to the extent that we had in the past pre the availability of vaccines and pre the availability of antiviral medications. Going to the wastewater signal across the province, you can see here that Ontario now is leveling off. You could see this was wave 6. This is the current wave that we have now. This is the one that we had in January. The big wave in April went upwards. And again, downward trend. Here you can see upward, but now it's leveling off. East is leveling and falling. Again, east is east of Belleville. And you can see other areas as well are variable. Most of them are leveling off, as you could see here, Toronto and others. If we look at the health units themselves that have had decreases in positivity, we are now one of them. We're right here. So you can see our 14-day decrease in positivity. We went from 15 to about 11. So that's good for us as well. And again, that reflects decreasing, but slow decrease. Again, I want to stress we still have activity, but it's getting lower. And so you can see other health units that have high increases as well. Some of them quite level here, not too steep of an increase on its own. And finally, I showed this to you last week, and this is again looking at the provincial data, which basically tells us that these are the orange here are patients in hospital, and you could see that these are the cases that sort of peaked July, August, and then downwards, and there's a bit of an upward trend here. But you could see sort of a downward slope, slowly, leveling at around 1,200 or so cases here. Much different than we had in previous waves, as you could see. And again, the ICU is kind of flat here at about 120 cases. So that again is important for us to monitor, because we want to be able to look at the extent of not only the cases but also the extent of the consequences of those cases. And so just to finalize and remind everyone, we need to we're going to be continuing to monitor the situation. We are of course encouraging people to stay home when they're sick. Again, just to remind everybody again, we're now looking at respiratory virus season, because we have seen significant increase in number of colds caused by rhinovirus, enteroviruses. These are the viruses that usually cause the common cold. We're actually monitoring the flu as well. We know that will be coming, and we will be releasing material about where you can get your flu shot, when, and so on. But we're going to be looking at a whole sort of system-wide approach of looking at the respiratory illness. So again, if you're sick, you stay home until you're well for 24 hours. If it's diarrhea, vomiting, for 48 hours, and then afterwards you wear a mask for the remaining period that makes 10 days from the first day of your symptoms. Obviously, washing your hands and is very important as well. Masking, of course, when if you've in contact with somebody, or if you've had COVID and you're COVID or not, regardless, if you have the symptoms, you should be considering it perhaps COVID or whatever, but it's the same precautions that you need to be taking. If you're vulnerable and going in crowded places where you're not sure about everybody else's status, you can please wear a mask. And those are the things that you need to be looking at your individual risk if you're going to visit people who are vulnerable and so on. And then finally, I just want to go back down to vaccinations. As you know, we have now launched the bivalent vaccine, and the bivalent vaccine now has specific activity against Omicron, which is what's circulating right now, which is what was causing a lot of problems, because people, despite being vaccinated, were still getting the infection, although they weren't getting hospitalized to the extent. So what we're trying to do right now is this vaccine is tailored, is more specific, and it's not much different now than the flu shot. Every year we have changes in the strains of the flu shots, and we know that, okay, they change. So we put in, it's the same shot, but it has different antigens, different viruses that we can protect, different strains. So it's kind of the same approach that what we're doing now. So this time we have the bivalent, which has two strains, the original strain that was in there, and a strain that promotes the production of antibodies against Omicron specifically. And studies have shown that you get good protection against Omicron B1 as well as B4, B5 with this vaccine. There's going to be in the future other vaccinations that are going to be more specific, and that is going to sort of fall into the routine that we have with flu shots, right? Where we'll have, on a yearly basis, for example, we'll know this is the circulating strain, and they'll tweak the vaccine to be able to give that booster effect against that specific circulating strain of COVID. So I encourage people to please go and get your next booster dose. We have a high rate of people having their first and second dose, but that only protects you for so long. If you're due for your booster, be it the third or fourth, please go and get it. It will be the bivalent vaccine, which will now give you protection against getting Omicron. for the first time, we'll be able to prevent Omicron, which is, I think, good news and a good step towards going back into normalcy. As I said, I think the pandemic is not over yet, but the worst is over, and I think that the end is in sight. And so if we continue to, vaccinate, specifically target those, we have approaches with antivirals, the precautions that we want to take, the masking, the washing your hands, staying home when you're sick, all those things together will collectively help us go to that finish line, which will be the end of the pandemic. And so I want people to understand that. And finally, again, I've talked about the pediatric vaccine as well. There'll be a Pfizer version of, there is a Pfizer version available for that. It's 3 shots. And the Moderna one is 2 shots. Again, parents have a choice for that. But again, I think it's important that we take advantage, particularly if you're a parent. If you have questions about it, please ask your doctor, your healthcare practitioner, your pediatrician about it, particularly if your child has underlying medical conditions. I think the child needs to be protected. And so vaccinating children will also increase the community immunity as well, and will decrease the transmission of the virus and decrease severe disease in that age group as well. So again, thank you very much for all that you do in the community. Let's continue. We are still living in a pandemic, but in a much better place. And so let's continue that way to be able to offset any surges that may happen. Let's prevent them as much as possible by getting vaccinated and taking all the other precautions that I mentioned. So thanks again. I'll talk to you next week.